Tuberculosis, or TB, is often associated with the lungs. This is the most common form of the disease and is known as pulmonary TB. When people think of TB, they usually imagine a persistent cough, chest pain, and the coughing up of blood. These are indeed some of the hallmark symptoms of pulmonary TB, which primarily affects the respiratory system. This is known as pulmonary TB. However, TB is a complex and multifaceted disease that can extend beyond the lungs. It is caused by the bacterium Mycobacterium tuberculosis, which can travel through the bloodstream and lymphatic system to other parts of the body. However, TB can affect other parts of the body as well. When TB spreads outside the lungs, it is referred to as extrapulmonary tuberculosis, or EPTB. This form of TB can be more challenging to diagnose and treat because its symptoms can vary widely depending on the organs affected. This is called extrapulmonary tuberculosis, or EPTB. EPTB can manifest in many different ways, affecting organs such as the lymph nodes, bones, brain, kidneys, and even the skin. Each manifestation of EPTB presents its own unique set of challenges for both patients and healthcare providers. EPTB is a serious health concern because it can affect various organs, including the lymph nodes, bones, and brain. For instance, TB of the lymph nodes, also known as scrofula, can cause swollen and painful lymph nodes, often in the neck. TB of the bones and joints can lead to severe pain and deformities, while TB meningitis, which affects the brain, can be life-threatening if not treated promptly. Early diagnosis is crucial and timely treatment is essential. The sooner EPTB is identified, the better the chances of successful treatment and recovery. Diagnostic methods may include imaging tests like X-rays and MRIs, as well as laboratory tests such as biopsies and cultures to detect the presence of TB bacteria in affected tissues. In this essay, we will explore EPTB in detail. We will delve into the various forms of EPTB, examining how each type affects the body and the specific symptoms associated with them. Understanding these details is vital for both patients and healthcare providers to ensure accurate diagnosis and effective treatment. We will discuss its causes, symptoms, diagnosis, treatment, and prevention. By the end of this essay, you will have a comprehensive understanding of extrapulmonary tuberculosis, its impact on health, and the importance of early detection and appropriate medical care. Join us as we uncover the complexities of this often overlooked form of tuberculosis and learn how to combat it effectively. Extrapulmonary tuberculosis, or EPTB, occurs when Mycobacterium tuberculosis bacteria infect organs outside the lungs. While pulmonary tuberculosis is more common and well-known, EPTB represents a significant portion of tuberculosis cases, especially in individuals with weakened immune systems. Understanding the pathways and impact of EPTB is crucial for effective diagnosis and treatment. The bacteria can travel from the lungs through the blood, spreading to various parts of the body. This hematogenous spread allows the bacteria to reach distant organs and tissues, leading to a wide range of clinical manifestations. Additionally, the bacteria can also spread through the lymphatic system. The lymphatic system, which is part of the immune system, helps in filtering out harmful substances. However, it can also serve as a pathway for the bacteria to disseminate throughout the body. EPTB can affect various sites, with lymph nodes being a common site. Lymphadenitis, or inflammation of the lymph nodes, is one of the most frequent forms of EPTB. Patients may present with swollen, painless lymph nodes, often in the neck region. Bones and joints can be affected too. Skeletal tuberculosis, also known as osteoarticular tuberculosis, can lead to severe pain, swelling, and even deformities. The spine is particularly vulnerable, and spinal tuberculosis, or Pott's disease, can cause serious complications if not treated promptly. The brain and spinal cord are vulnerable as well. Tuberculous meningitis, an infection of the membranes covering the brain and spinal cord, is a life-threatening form of EPTB. Symptoms can include severe headaches, fever, and neurological deficits. Even the digestive system can be impacted. Gastrointestinal tuberculosis can affect any part of the digestive tract, leading to symptoms such as abdominal pain, diarrhea, and weight loss. It can mimic other gastrointestinal diseases, making diagnosis challenging. The symptoms of EPTB depend on the location of the infection. For instance, tuberculosis of the skin may present as persistent ulcers or nodules, while genitourinary tuberculosis can cause urinary symptoms and pelvic pain. Each form of EPTB has its own set of clinical features, which can sometimes overlap with other diseases. Diagnosis often involves imaging scans, biopsies, and laboratory tests. Advanced imaging techniques like CT scans and MRIs help in identifying the extent and location of the infection. Biopsies and microbiological tests are essential for confirming the diagnosis and determining the appropriate treatment. Early and accurate diagnosis is key to managing EPTB effectively and preventing complications. EPTB is caused by the same bacterium as pulmonary TB. This bacterium is Mycobacterium tuberculosis. It spreads through the air, and people with weakened immune systems are more susceptible. HIV infection is a significant risk factor. Other conditions like diabetes can also increase the risk. Lifestyle choices matter too. Smoking weakens the immune system, and malnutrition makes the body more vulnerable. EPTB symptoms can vary greatly. The location of the infection dictates the symptoms. Lymph node. EPTB often presents with swollen lymph nodes. Bone EPTB may cause pain and swelling in the affected area. EPTB of the brain, known as tuberculous meningitis, can cause severe headaches, fever, and neurological problems. Early symptoms can be vague, making early diagnosis challenging. Any unusual or persistent symptoms should be checked by a doctor. Diagnosing EPTB can be complex. It often requires a combination of tests. Medical history and physical examination are essential. Imaging tests, such as X-rays and CT scans, can reveal abnormalities. Biopsies may be necessary to obtain tissue samples. Laboratory tests are crucial. These tests can detect the presence of Mycobacterium tuberculosis. Culture tests can confirm the diagnosis. Section 6. Treatment, a journey to well-being. EPTB treatment typically involves a combination of antibiotics. The treatment regimen usually lasts for several months. Adhering to the medication schedule is crucial for successful treatment. Directly observed therapy, or DOT, is often recommended. This involves a healthcare worker observing the patient taking their medication. DOT ensures adherence to the treatment regimen and minimizes the risk of drug resistance. Section 7. Prevention is key, protecting yourself and others. Preventing EPTB involves a multi-pronged approach. Vaccination with the BCG vaccine offers some protection. Early detection and treatment of latent TB infection are essential. Infection control measures are crucial. This is particularly important in healthcare settings. Proper ventilation and respiratory hygiene can help prevent the spread of TB bacteria. Section 8. Living with EPTB, overcoming challenges, embracing hope. Living with extrapulmonary tuberculosis, or EPTB, is a journey that many find daunting. The challenges are numerous, but so are the opportunities for hope and recovery. This section delves into the multifaceted aspects of living with EPTB, highlighting the resilience of those affected and the support systems that play a crucial role in their journey. Living with EPTB can present challenges. From the moment of diagnosis, patients often face a whirlwind of emotions and uncertainties. The initial shock can be overwhelming, but understanding the disease and its treatment options is the first step towards managing it effectively. Regular consultations with healthcare professionals are essential to monitor the progress and adjust treatments as needed. The disease can impact daily life. EPTB can affect various parts of the body, leading to symptoms that disrupt everyday activities. Fatigue, pain, and the side effects of medication can make even simple tasks seem insurmountable. However, with the right strategies and support, these challenges can be managed. Patients are encouraged to maintain a balanced lifestyle incorporating rest, nutrition, and gentle exercise to help alleviate some of the symptoms. Social stigma can be a concern. Support systems are essential. The fear of being judged or misunderstood can lead to feelings of isolation. It's important for patients to know they are not alone. Support groups and community resources can provide a safe space to share experiences and find comfort in the company of others who understand their struggles. These groups can be a lifeline, offering both emotional and practical support. Family and friends can provide emotional support. The role of loved ones cannot be overstated. Their encouragement and understanding can make a significant difference in a patient's journey. Simple acts of kindness like a visit or a phone call can lift spirits and provide much-needed motivation. Families are encouraged to educate themselves about EPTB to better support their loved ones. Support groups can offer a sense of community and shared experience. These groups bring together individuals who are facing similar challenges, creating a network of mutual support. Sharing stories, tips, and coping strategies can be incredibly empowering. It helps to know that others have faced similar hurdles and have found ways to overcome them. It's important to remember that EPTB is treatable. Advances in medical science have made it possible to manage and treat EPTB effectively. Adhering to prescribed treatments and maintaining regular follow-ups with healthcare providers are key to recovery. Patients should remain hopeful and proactive in their treatment journey. With proper medical care and a positive outlook, individuals with EPTB can live full and meaningful lives. The journey may be challenging, but it is also filled with opportunities for growth and resilience. By embracing hope and leveraging the support available, patients can navigate their path to recovery with confidence and strength. Section 9. The future of EPTB research, innovation, and eradication. Significant progress has been made in combating TB. However, more needs to be done. Research is ongoing to develop new diagnostic tools, more effective treatments, and a vaccine that provides better protection. Increased funding is crucial. Global cooperation is essential to eliminate TB. By working together, we can strive for a world free from TB.